Yeah, since leader.
Come this side.
Sorry? Leader. Is that what you're referring? Leader, right? Leader. You're the leader.
Self-praise, right?
Okay, so since okay, since Rita said that we should talk at molecular level, we all been studying about drug targets and what a particular antibiotic is targeting. So basically, when she was first given the course, maybe the pathogen by then had started changing the proteins and changing the targets. Target sites had been altered. That could be one reason. Second, they said mixture of infections. So whatever microbes were present, let's say one class of drugs was given, streptomycin, it affected only one group of pathogens.
What are those type of antibiotics called? It only affects one class. Those are antibodies.
Sites.
Now what are those antibiotics called which tend to kill broad spectrum? So what would this be?
So maybe the other pathogens proliferated then, and those weren't really good. Third, these days, a lot of microorganisms have gained resistance to the basic antibiotics available in the market. So you need to use like a really high dose, a really high concentration of antibiotics these days to even kill like probably the smallest microorganism species.
Alright, fair enough. 2 points? Okay, those are concentration activities. Fair enough, yeah, perfect. Okay, so is there a possibility? So you know what? I recently had, I was feeling unwell, okay, and I went to the doctor and he actually diagnosed it as viral. He was very sure it is a viral infection, alright? But he still put me on antibiotics.
Sorry?
I was a confirmed viral infection patient here, okay, but he still put me on antibiotics. Why would he do that?
Some virus feed upon bacteria, other pathogens, maybe.
So viruses feed upon bacteria, right? So then why do I need antibiotics? The enemy is feeding on the bacteria, right?
Like if he gives the antibiotics, it will affect both the bacteria and the virus.
Okay. So if I were to give you a hint, let's say there was an immune system component involved in that. There's a reason why I'm asking you this, because we have correlation with this. In the first place, do you think it was fair of the doctor to give me antibiotics though he knew I'm a confirmed viral infection patient? He doesn't know. He didn't put me through the test. He examined me. See, I went with fever. Okay, let me tell you. I went with fever, sore throat, body pain. Alright, I went to the doctor. I said, these are my symptoms. He said, for how long? Right? And then he was very sure it's a virus doing the rounds and it's a viral infection. So he said, take adequate rest, take lots of fluids, take Crocin as an SOS whenever you have fever, and please take augmented duo 650 mg for next 5 days.
The body will recognize the particular antibiotic and hence release those antibodies into the blood. Based on, like she said, memory cells that are present in the immune system.
Okay. Fair enough. So basically you are alluding to the fact that if an immune system weakens, or if it's had prior exposure to a certain bacteria, I have a chance of getting a secondary infection which could be bacterial. Yeah? Fair enough?
Push to the immune system basically.
Okay. Vishnu wants to come next and give us points why there could have been an antibiotic resistance. Shrepa, you want to come?
Common enough, we have these two ideas. But
On the side.
differing from this, she might have taken the antibiotics which she had consumed. It might have some mutant variety, and that is why it has been fluctuating. The disease comes down, and then the more level of the disease increases. So the antibiotic that she had consumed might have a mutant variety. Then the drug might be a multi-drug resistant like XL. In the recent studies, we have studied superbugs,
Perfect.
something like that. We have assumed.
Very good. So you were saying it was a superbug which was a mix of a lot of dangerous bugs. Yeah. Yeah.
Then the concentration might have been more for the pathogens.
So MDR variety is one that you are saying, right? Okay, now let me just pose another question to you. Let's assume that this was, everybody understands MDR, multi-drug resistant? Yes. Any team which doesn't? Everybody does? Okay, let's assume that it was a serious case of an MDR infection or a variety, right? So how do you think you're going to tackle this if you were a doctor? As a team, you know, you can help her out. Okay. Set of. What do you think would have led to an MDR phenotype in the first place? So basically, did you hear what she said? She said if an infection is an MDR type of infection, the best way of treatment would be give that patient a broad spectrum antibiotic. I'm sorry. Yeah? But why do you think in the first place an MDR type of, bacteria evolves?
Constant exposure.
So which means probably the doctors are constantly giving broad spectrum antibiotics, and as a result, they've evolved and now they become MDR, right? So actually what the cause was, using that as a remedy, I'm not saying it's wrong, I'm just asking you. Does it make sense? Yeah? Think about it. Yeah. You have any other point? So what do you typically, so do you guys go to biotech and mobile labs? Do you do techniques?
Yes.
So you do a lot of recombinant DNA technology methodology?
We haven't started yet.
Oh. So you know what are cloning vectors?
Yes.
Name one, popular one.
PUC.
Broad category. Plasmids and plasmids. Does it give you some names? What are plasmids? You got the textbook things. Yeah? So if I were to ask one striking feature of a plasmid, what is that?
Ability
Sorry?
to carry a
Self-replicating. Something else. Why do you use it in a lab? Primarily, why are you using it in a mobile lab?
It's
Research in a gene of interest. So what? You can just chop it and put it? It is
drug resistant.
Which drug resistant? I said I want reasons why a patient might get resistant to a certain class of antibiotics. You've already given me an answer. Somebody has to frame it again.
Mutation.
Destroy that plasmid.
Mutation in the genome of the plasmid basically.
What happens?
The genes which particularly code for that particular protein, like I said, and the antibiotic is killing it. Over the years, it's sensing that, okay, fine, I'm going to get into danger if I keep producing this protein. So it produces an alternative protein.
What's that phenomenon called? You said evolution, right? Yeah. But is there a specific term for that? Mutation is one, I agree. But she said over generations the bacteria will get very smart. Sorry? Transformation, I agree, is a method where one bacteria will keep pushing plasmids into others, so you have conjugation and all of that, right? Okay, let me now rephrase this question. What did Darwin do? Darwin.
Studied about natural selection.
What is natural selection? So do you see that was happening with this at a molecular level?
Yes.
Anybody who disagrees, please, I want something to do. No? So pretty much molecular level we are